Hey, welcome back to the podcast. I'm your host, Vanda, founder of the Period Makeover Solution and Fertility Maximizer. Today, I want to talk about a topic that might be triggering for some, is a very serious and a very sensitive topic. So I just want to warn you about that up front. And if you feel that this episode might be triggering for you or hard for you to hear, or just something that you're not interested in hearing me chat about, I want to invite you to skip this episode and come back next week. That's totally okay. Absolutely take care of yourself and your own mental health before we jump into this conversation. So, I want to take the opportunity that we have right now to chat about the Lindsay Clancy trial. I want to do that because I think that it is getting a lot of attention. I myself can't pull myself away from the trial. I just can't stop watching all of the live coverage, all of it. I'm knee deep in it. But I think that it gives us such an important opportunity to talk about postpartum depression, postpartum anxiety, even postpartum psychosis, and for my audience, for you guys specifically, how to prepare yourself and be aware of these things even before you're pregnant or early on in your pregnancy, to prepare for it before you actually hit that postpartum period. And that's really what we're going to focus on today. This episode isn't going to be about my own personal thoughts on the case, deciding whether someone is guilty or not guilty, or should be held responsible or shouldn't be held responsible. If you want to chat about the theories, your thoughts, all those things, slide into my DMs on Instagram. More than happy to do that. I just don't feel like this podcast episode is the place to do that. So, all of that being said, like I said in the very beginning, if this is going to be triggering for you, hard for you, you have strong feelings about the case, take this opportunity now to hit the skip button and move along. It's okay. You can always come back next week. We're going to be talking about something totally different. Now, I want to also preface this by saying I'm sitting down to record this on Friday morning, August 21st, before the 18th day of trial has started. That's not going to be super relevant because of what we're talking about today, but I just have no idea what's going to happen and come out between now and next Tuesday when this episode is going to go live. So I just want to give you that additional context as well. Now, the big thing that I wanted to talk about was postpartum depression and postpartum anxiety. I think that, before I had my babies, I had heard the term. Of course, I'm a nurse, and I also got pulled over to the labor and delivery unit. So, I knew the basics. I knew it existed. I knew that it was a very real thing, but I don't recall getting educated in my prenatal care, like by my providers, very much at all about it, if any, to be honest. And I definitely wasn't, there was no sit down conversation before I gave birth and even after, but we'll get to that in a second, as to this is what this is how you look for it, this is what you should do if you start prenatal care specifically. And hopefully, maybe this giant conversation we're having right now about it will help close that gap for people in the future, because it's very necessary. And it's so much better to know these things up front and be on the lookout for them, educate your partner and your family about them so that they can also be on the lookout. And rather than dealing with it reactively when it's happening to you, and you or your family or your partner are like, what is going on here? I don't know how to help you. I don't know what to do. So there are different forms of this, different levels. I want to talk first about what we refer to as the baby blues. There are big shifts in your hormones that happen almost immediately when you give birth. You have a big drop off in hormones. This is also impacted by like whether or not you're breastfeeding. And that shift is going to feel differently to everyone. But the fact that there is a big shift is true across the board. And it's true no matter what type of birth you have, how long you're in labor, things like that. Now, there are aspects that can impact this and make it different for everyone. Things like if you have a traumatic birth or not, if you have a very long labor, um, things of that nature. Like those can have an impact, but regardless, even if you have like the most to the T, quote, normal delivery that it was to ever be, you are still going to experience a dramatic shift in your hormones in those first few days, and things are still going to continue to shift and move and change over those first few weeks. That causes, obviously, an emotional response. And this can show up in different ways for everyone. It might show up in you being more like tearful than you expected, feelings of sadness when you thought you were going to be the happiest you'd ever been in your life. On the flip side of that, it might make you feel like heightened or very um, like how am I trying to say this? Like out of proportion happiness or excitability. Um, that's not common. The kind of down and bordering on depressed type feelings, unexplained sadness or sadness that doesn't feel proportionate with what you're, this happy life experience that you're having. That typically is going to resolve in about 2 weeks. And if it's mild, that would be considered normal. And it's due to those shifts that you're having in your hormones. It is, again, good to tell partner and family that this happens to most women after they give birth, that they have a lot of emotions, they're very emotional, they have a lot of feelings. It's due to hormonal fluctuations so that they're not caught off guard, maybe by your emotions or your reactions to things during this time period. Then, when we get into conversations about postpartum depression and postpartum anxiety, this is when this lasts for beyond those initial like 2-ish weeks, and it is more intense, more prominent. It might not even happen to you at first. It might come a few weeks later, sometimes even a few months later. It can still be related to all of the hormonal shifts that are going on in your body after you've had a baby. And from my standpoint, in the work that I've done with women, postpartum women in the past, and myself, and like the testing that I do, and what I typically see in someone that's postpartum on their, I call it a fertility nutrition test now, but it's an HTMA test where we're looking at their minerals. When you have mineral levels that are also fluctuating, so they might be really low, copper is a big pregnancy related mineral, and sometimes it can become dysregulated after pregnancy. And when we have dysregulated copper, it can bring on a lot of emotional type symptoms, whether it be depression, anxiety, or both. So there can be many different factors at play. It's not solely the hormones. It is very much hormone related, but it can also be mineral related. And we have a good opportunity to address a lot of those things if you're getting the testing done to know and recognize that that's what the issue is. But of course, you guys know from being in my audience, that is a functional medicine approach to things. It's not something that your OBGYN is going to run or tell you about. We also have to acknowledge that women's postpartum care is very limited. For most people, you are only going to be seeing your OBGYN one time, maybe two at the most in certain situations after you've given birth. So that is the person in our traditional route of care that has the most experience and knowledge about hormones and those fluctuations. And we are typically only seeing them one time after we give birth. And it's usually about 6 weeks after you've given birth. Um, I don't know if every pediatrician's office does this, but mine has always given me the what am I trying to say? Postpartum depression and anxiety scale, like the screener form. They've always given that to me the first several times that I have brought my baby back to the office, like when we're going frequently for weight checks and trying to get back to our birth weight, and if their Billy levels are high, things like that. It was always given to me for at least that first like month or two after they were born. Now, then it stops, and then nobody is asking those questions. You're not filling out that questionnaire. And if for those of you that have never been through this before and you've never seen this questionnaire, you've never filled it out before, you can look it up online. It's a very wide known, widely used tool to screen for postpartum depression and postpartum anxiety. But it asks you questions like, over the last, I think it's a couple of weeks. I can't remember the exact phrasing. I should have brought it up before I started recording, but I didn't. How often have you felt like a lack of interest in doing things? It's screening for these feelings. It gives a score. And then they use that cumulative score to say, like, okay, yes, this person seems like they might be experiencing this or they're at risk for developing this. And they can then offer interventions, offer resources, depending on that. It's a scale that when you do go for that postpartum follow-up appointment, they're going to give it to you. You're going to fill it out. I encourage all of you to really answer those questions honestly. That's how we can use the tool the best and rely on it as a true screening tool. We have to remember that it's very important to be honest with our providers. If we're not being honest and transparent with them, then they can't use all of the tools and the resources and their knowledge to help us if we're not giving them the information that they would need in order to give us that help. So that's, there's, I think, sometimes a fear and maybe guilt that women experience not wanting to truly share that we might be experiencing these thoughts or these feelings. And it's important that we feel comfortable enough with a provider to do that. And if you don't have a provider that you feel comfortable enough to do that with, then maybe seek out new or different providers that you can build that type of relationship with and that type of rapport where you feel comfortable. When to seek care and when to seek more help. My kind of rule of thumb on this is number one, find your person in your circle. Like for me, it would be one of my best friends. I have two best friends that I can comfortably tell literally anything to. I know they're not going to judge me. I know they are going to be honest with me with their feedback and how they interpret a situation or how they interpret something that I'm telling them and what their honest opinion is on how I should move forward. These two best friends would also not hesitate to sit me down and have a conversation with me and be like, hey, this is what I'm noticing. And I want to check in with you. I want to see how you're feeling. This is what I'm seeing, and I just wanted to see what your thoughts were on that or what you could share with me about how things are going, how you're feeling. Is this what you're feeling? Because this is what I'm seeing. And they would do that with me in a very loving and supportive way, not I'm pointing my finger at you because I think there's something wrong here or I think you're doing something wrong. It's so important to have that person in your circle so that they can be a safeguard for you if things start to go sideways and you aren't in a mental space to advocate for yourself at the moment. That might be your partner, it might be your mom, it might be your sister, it might be a best friend. But it's important to have that person and to share things with that person in total honesty about how postpartum is going, how you're sleeping, how you're feeling, how the baby's doing, without fear of being judged. And then also remember to the best of your ability at that time to take any observations or any input that they have in confidence, knowing that they have the best intentions with what they're sharing with you and what they're observing and what they're saying, and know that you might need to take action on what their worry is for you. So that would be one time when it would be time to seek help, is if other people are expressing to you that they're concerned about your well-being, your physical health, your mental health. If they are saying things like, I just noticed that you don't seem like yourself. I'm really worried about you. That would be the time to seek help. Another kind of rule of thumb is if you are doing kind of like a self-evaluation and you're thinking, I don't think this is normal. I don't feel like this is supposed to happen this way. I don't think I should still feel this way. I don't think I should be having these thoughts. Connect yourself with a trusted professional that can guide you and help you figure this out and decide, like, no, this is a normal thing. This is what you should expect moving forward. This is when you should expect it to resolve. Or, no, actually, I'm so glad that you brought this to my attention, because I do think we need to get you some help here. And here's a plan for how we're going to move forward and get you the help that you need to get through this period of time. That looks different for everyone, and this is not my specialty. So I can't and don't want to give guidance or tell you exactly what's going to happen, because again, it's not my specific area of expertise and focus. I know that some of those interventions might look like therapy, connecting with a counselor, seeing a psychiatrist, getting medications. But I don't want to speak to specifics, because I feel that would be irresponsible of me, because it's not my specialty. It's also important to remember during that time, if you are feeling off, if you are feeling like you need help and you're seeking that help out for yourself, remember that the follow-up is very important, and continue to keep those follow-ups and following, a collaborative treatment plan with your provider so that you can get the help that you need. Now, I just said that my recommendation would be to continue to follow a collaborative treatment plan. And I was very careful in the way that I said that, because there was something a few days ago that really irritated me. It had me really fired up. And this is my sole opinion. This might ruffle some feathers. It might take some people off, and that's okay. It's my opinion. It's my opinion from my personal experiences. It's my opinion from my years of being a nurse, from my years of working with clients on their hormones. I was listening to a podcast a few days ago that has been regularly putting out episodes on the trial, giving summaries of each day and what their thoughts are on the case. And they were discussing all of the medications that Lindsay had been prescribed. And they were talking through this long list of medications. And they were also going through kind of some of the communications that she had had back and forth with her providers and pointing out, and I felt demonizing. I don't have a better word for it. Demonizing the fact that Lindsay expressed to multiple providers, multiple different times, that she didn't really want to be on medication. Also demonizing the fact that at times Lindsay had stopped taking medications due to side effects or feeling that they were making her worse. And I do understand both sides of this argument. One argument can be made that she was being provided with a treatment plan by a trained professional, and she needed to follow the treatment plan because she wasn't giving the treatment plan time to work. The other argument could be that if you feel a medication is making you worse, you are the only person that is in your body that knows how you're feeling and knows the change in how you are feeling. I have always been a proponent of self-advocacy, and I still stand behind that. I think it is completely within your right to be, and it's the whole point. Like, this comes from my nursing background and my nursing training, but it's drilled into our heads that the patient is part of the care team. They are part of the creator of the care plan and the plan moving forward. And I don't know that they intended it this way, but the way it came across, the way it was perceived by me, was that they think people should essentially just shut up and do whatever their provider is telling them to do. And that is such a dangerous place to get in healthcare, in any sense of the word, whether it's mental health, physical health, whatever the situation might be. If you are someone that literally just goes to your doctor and does every single thing that they say, no questions asked, you continue to do it no matter how it's making you feel or what side effects are popping up, that can be so dangerous. I do understand, again, I understand the flip side of that argument of like, these were the professionals, they were giving her the best recommendations that they knew to do from their years of experience and their areas of expertise. And I do value the fact that, especially when we're talking about mental health medications, there are lengths of time that we have to take a medication before we can see its positive effects. Again, I just did not like the fact that it felt they were so demonizing her expressing not wanting to be on medications forever, being concerned that she was going to get addicted to medications, and choosing for herself to stop medications that she felt were making her worse. Now, do I think that someone should talk to their provider first before deciding to stop a medication? Yes. And the reason the reason I feel that way is because, especially with mental health medications, you often have to taper off of those and could experience even more negative side effects if you abruptly stop them. I'm not saying at all that she handled this in the best way or the most appropriate way. It just stuck out to me, and I was so fired up about it because of my passion for patients and sometimes their family members to self-advocate and be self-aware of how they're feeling, what they're going through, and how a medication is making them feel and what change it's causing in their body. And I don't know, I guess I'm going to leave that there. I know my thoughts on that were probably a little scattered and a little, back and forth, but the point I wanted to get across is I don't want people to hear that and hear the way they portrayed it and take away from that that you as an individual should blindly follow recommendations from a doctor and just do exactly what they say always, regardless of all the things, just because they're a doctor and that's what they said to do. I think that's a very dangerous place to be in. It's a very dangerous decision to make. And again, the emphasis I want to make is that with anything, but specific to this conversation, postpartum depression, postpartum anxiety is going to be best managed and best treated for you if you work collaboratively on a care plan that everyone feels comfortable with, including yourself, your provider or providers, and your family if you have family involvement. So, I do just want to kind of close, I guess, with a reminder that postpartum depression and anxiety is a very real thing. It happens probably more commonly than you are even aware of, that honestly, statistically, we're aware of because of women's fear in sharing it, reporting it, feeling like they can't be open about it, even if they're sharing it with their provider, keeping it from their loved ones and their friends and sometimes even family, because it can feel like such a shameful thing. But I just want to give the reminder that it is something that happens. It's not your fault that it happens. It's not something that you can control. It's not something to be ashamed of or beat yourself up about. It's just something that you do need to take the time to get yourself the help that you need to take care of yourself. Because when you take care of you and your own mental health, you are also taking care of your baby and your family in a way that's not direct but indirect, because if you as the mom are not well and not feeling well, then you're not going to be able to show up as your best self and enjoy this part of motherhood and starting a family that you have probably desired for so long. And there's nothing wrong with needing help or getting help during this time. Your body has been through a lot. And, like I said earlier, it's not your fault and it's not something that you can control. There are resources available specific to postpartum. Of course, you will have access to your OBGYN's office, your primary care provider. You probably have mental health professionals in your area. There is also the National Mental Health Crisis Line 988. You can dial from any phone wherever you are in the United States and get help. There's a postpartum support international hotline, a number that you can call. You can Google that, look that up. I don't have it right in front of me, but you can find that number and reach out to them. That's a very specific to postpartum resource. And you're likely going to get a little bit of education, but resources like that bag of stuff that they send home with you when you leave the hospital, I guarantee you it's going to have a number to call, probably some websites, maybe even a pamphlet in there on postpartum depression, postpartum anxiety, what to look for, what to do if those things start to show up. So don't dismiss that. Don't just chuck it in the trash. Maybe pull that piece out and save it, put it in your bedside table, put it in a drawer in the kitchen. That way you could easily reaccess it, pull it out if you need it, and also share it with your partner. And again, maybe your mom, maybe your mother-in-law, maybe just a close friend, I don't know, someone that can be kind of your lookout for if and know how to express concerns to you if they begin to get concerned. Okay, I know that was a heavy topic. I know that we don't normally talk about heavy, sad things on this podcast, but like I said, I am knee deep in this trial, literally can't pull myself away from it and the conversations around it. And I felt like it was a good opportunity for us to talk about this topic because it's already being talked about so much. And I just wanted to share some of, my thoughts, suggested resources, a little bit of pregnancy and postpartum prep for you, if you will. So I'm going to leave you guys there for this week. I hope you have a great rest of your week, and I hope that you guys will tune back in next week. I'll chat with you then.